Great! Sorry guys, welcome to 2019 and welcome to the first episode this year of Chalfont Clinic TV. Got a bit of a treat. It's you're lucky enough not to have just one director and one chiropractor today. You've also got two. So today we're joined by Rachel, and we decided to do a bit of a pregnancy, I don't know, talk if you like, purely and simply because we've had a few requests. Rachel and our other practitioner Renata also see a lot of pregnancy and a lot of children in the clinic, so it's just useful for us to do a video. So a special shout out to Rachel, who's a friend of mine who is actually a midwife as well, who requested that we do a video on pregnancy and babies and children. So this is going to be a bit of an oversight. So Rachel is obviously my business partner, and she has been treating pregnancy and babies and everything for, well, ever since you graduated.
Oh gosh, 17 years now.
17 years, a long time.
Yeah.
Okay, so what made you interested in babies, pregnancy, children? What made you interested in that?
I've treated since graduating, because we did do a lot of training while we were at uni. I've done a lot of further studies since, of course. I enjoy it. I mean, the changes you see, the responses you see with pregnancy are pretty rapid, and the patients are very, very happy, of course, because they're so uncomfortable a lot of the time.
Yeah.
I love children, so I enjoy them running around. It doesn't bother me. I know some people don't. But again, especially with the tiny ones, the little newborns that get brought in that aren't really feeding well, perhaps. Sometimes it's pretty much an instant change. It's very satisfying. So that's something I've pursued more and got more experience in. So yeah, really enjoy it.
Good.
And it's a huge part of our practice, isn't it?
Well, it's
a big number.
Yeah, I mean, we've now got, you've got quite, obviously, from obvious reasons, close connections with the NCT groups.
Yeah.
So is it this Beaconsfield NCT group?
Yeah.
We've also got a lot of close connections with sort of other companies. I mean, you use the Barista Pillow quite a lot.
Sharon Saki produces and makes that, and it's amazing.
This is our pregnancy pillow, which actually works really well for patients who are either really finding it uncomfortable lying on their tummy. So I've got a few that I've actually borrowed for.
Absolutely. I mean, it means patients can lie on their front, which makes it a lot easier for us to be able to assess their pelvis, work on their backs with them much more comfortable. And most patients absolutely love it. But I've got patients with stoma bags, recent abdominal surgery, perhaps breast surgery, or for other reasons they're just not comfortable. So we use it a lot, actually. It's fantastic. So I'd recommend any chiropractor to have it, really.
Well, because Sharon Saki is obviously the chiropractor who designs.
She's designed, and she owns a company.
She owns a company.
Yeah.
But she actually did a stint for us whilst you're on maternity.
She did my second locum cover. So yeah, Sharon's amazing. So we know her well. So we can put anyone onto her if you're interested. But that's a good product. We use it a lot.
Fantastic. I mean, I've borrowed from your room quite a lot.
We need a couple more, actually, Sharon, because the massage girls like it as well. So
they've got a few that they use it for. Yeah. So it's a great tool to have in and around the clinic. But as you say, we do see an awful lot more now. Pregnancy, children, babies.
Yeah, it's huge.
It's massive now. I know I treat children. I have done since I was probably going through university. Being my younger brother and sister at the time were probably 5-10 years old, and I remember coming home at Christmas and them asking me to have a look at them and sort of treat them.
Little sports injuries and bits and bobs.
Hundreds of random things. But you obviously having the two little girls as well.
Yeah.
Not so little anymore. But when did you start treating them?
The day they were born. Yeah, in hospital.
Was there any particular reason behind that though?
Well, I understand and know the benefits of what we do. So patients that are brought into us a lot of the time have symptoms. So patients are, the parents are concerned because they're not feeding or they're not latching on properly, or they've had a forceps delivery, or there's a reason why they suspect there's some sort of trauma or pressure on them. A lot of babies are brought in because their parents are existing patients, so they know the benefits of what we do, so they bring them in for a checkup. Or a lot of the time I've seen the mum through pregnancy. So she's obviously experienced what we've done and we've talked about it, so they brought them in for a checkup. So I know how important it is to make sure babies' spines and alignment are as best as they can be, so they don't develop these sorts of problems. And my kids haven't had any colic or anything like that. So I was just checking out their heads, their necks. I mean, they're both cesarean deliveries for various reasons.
Well, because it's obviously, we get taught from an education point of view that it is one of the most traumatic things the human body can go through, both from the mum's perspective and from the baby's perspective. So it is interesting. I mean, especially during pregnancy, the way in which the body changes to accommodate the need to give birth.
Oh, it's amazing, but you get aches and pains as a result because we continue to lift and go to work and drive and do all the things we're probably not supposed to do.
Yeah.
But it's very gentle and very easy to keep people comfortable. Especially the earlier you come in your pregnancy, the better.
Yeah.
And don't wait till you're hobbling around on crutches at the end, ideally.
Well, also, you completely understand exactly what your body is capable of doing throughout your pregnancy.
Yeah.
If you've had a checkup, if you know what you're up to, and what sort of pains, aches.
Well, this is it. A lot of people just want advice, and they want to know what is normal, what should I be feeling, but also what they can do about those aches and pains, because you can't really take any painkillers.
No, not at all.
So, for our point of view, we're looking at women's backs and pelvises, well, the whole spine, but more the pelvis. A lot of the time it's restricted or it's twisted, it's not in the right position, and that distorts the ligaments, which are already sore because of hormonal changes.
Yeah.
They get inflamed.
Yeah. And
a positional difference or rotation will affect the alignment of the pelvic floor, the uterine ligaments. It can cause the baby to actually not be in a comfortable position. For example, we get women coming in more towards the end of pregnancy that perhaps have a breech position.
Yep.
And
there's
just
a couple of techniques
realigning,
for that, isn't there?
Yeah,
for breech?
that's quite a specific thing. Again, very gentle, quite easy to do once you know what you're doing.
Yeah.
Very gentle for mum. But I've seen so many times it turns ever so easily. We don't try and turn the baby like you would perhaps get in a medical environment in hospital. It's just working on the mum.
So the
question, and that's quite powerful.
The question I know we get asked quite a lot is, do we treat pregnant patients, and I'll ask the same later on about sort of babies and children, but do we treat pregnant patients the same way we treat normal patients, our general day-to-day patients?
In terms of manipulation?
In terms of manipulation, soft tissue, in terms of everything?
Yes, there's absolutely no reason why they can't have exactly the same treatment. I always find though, because of ligamentous changes and women are a little bit looser, actually you don't need to manipulate with half as much force, and I don't anyway. We're always very gentle because we don't want to make them uncomfortable or make them more sore, put any undue pressure. But I mean,
and
running
nervous
around,
as well, I imagine.
Yeah, exactly, a lot of women are.
Yeah.
But lifting their other children and doing the other things. A lot of women go to the gym.
Yeah.
You're stepping off curbs heavily. They're actually putting a lot more pressure through their bodies than we would ever do anyway.
Yeah.
So yes, they can have exactly the same treatment, but we're just very gentle because actually you don't need to do that.
Yeah.
But we work very much on the soft tissues. So it's about aligning the psoas muscles and working on all the other ligaments. It's not just manipulation. So
how far through do you? I mean, I've treated several patients, pregnant patients in the past. It's not my bread and butter, and it's not what I prefer to be treating, because obviously you're a lot more experienced in it, a lot more understanding and empathetic, sympathetic as well. But I know I've treated patients right up to full term. Is that?
Oh yeah.
That's normal, isn't it?
Oh yeah, definitely. As I say, the earlier the better, because you can prevent a lot of problems from coming on and give them lots of advice on how to manage things and work on their core and things. Right up until I have patients who perhaps have an induction date, or they know they're going in for cesareans and things, and they'll come along, just before, the day before perhaps. Yeah. And some women say to me, if I'm really struggling and my labour's slow, can I come in and have a treatment if they're suffering? Absolutely.
And that
it's not
actually
going to cause any problem.
It must combine quite well with, obviously we've now got a sort of Hannah who deals with sort of pregnant massage, and we've also got Cindy who deals with
she does acupuncture
and things for labour inducing. I mean, that must coincide quite nicely to be able to refer between the two. When patients, they often come in for one and the other in the same sort of session.
Yeah, I mean, not just for pregnancy, I mean, all of our patients, they benefit from all of our services, don't they, very nicely. And it works very well together. And pregnant patients, because they tend to like more gentle care, they love the acupuncture and things as well. And Hannah's, recent qualification for pregnancy massage, that would be a good asset. So
let's talk about babies. So, obviously, my youngest patient was in clinic when I was in my clinical year at university. My youngest patient was 5 days old. Yeah. You've obviously treated both the girls from day one. Yeah. Why are people quite reserved, really conservative about when to get their kids in for treatment? Because there is that sort of air about, how young is too young, and.
Well, I think for a lot of people, unless they've experienced what we've done or have talked to us and asked questions, perhaps imagine that chiropractic treatment is only forceful pops and clicks, quite a manual, potentially sometimes can be perceived to be a bit of an aggressive thing. Yeah. And of course we're not going to be doing it on babies. No. So I think that's often why people are a bit, well, why would you manipulate a baby? Yeah. You don't treat them the same way. We're assessing the same things, we're working on the spine, we're looking at alignment, making sure everything's working properly, but you don't manipulate them in the same way because they don't need it. It's very gentle, soft tissue stuff, so it's perfectly safe. And the babies usually fall asleep to it a lot of the time. So.
Half of them is helping the parents, helping the guardians, whoever it is who's bringing them in, helping them understand why we're doing what we're doing and the actual reason behind it. Yeah. I mean, generally speaking, normal types of babies, the reasons why people bring their children, their babies in to see you are what? I mean, obviously we get the colicky sort of symptomology.
Yeah, often they're just very restless. They're perhaps not sleeping that well. They're waking up all night. They're screaming a lot.
Yeah.
Seem very fussy. Just aren't that settled. So the parents are concerned that perhaps they have some sort of discomfort, or there's a reason why they're like that. And yes, a lot of the time it's a biomechanical issue.
Yeah, 100%.
Obviously we work alongside, and it's very important the patients remain under the care of the midwife team and the GP as well, because yes, of course there can be other issues that are causing reflux or other problems going on, like a dairy sensitivity or something that needs medical advice perhaps. But from a chiropractic point of view, a lot of these symptoms are brought on because the baby's heads have been restricted perhaps through childbirth.
Yeah.
That's obviously the most common thing.
Yeah.
Often it's the top of the neck, so that's a really common spot that we'll treat up there. But when there's constipation, there's all sorts of other things that babies get brought in with, so we need to check the whole spine.
Well, we had a lot of emphasis, I know when we were at university, we had a lot of emphasis placed on us about that relationship between the midwife team and the chiropractors as well. I mean, I clearly remember the major emphasis was make sure you get that little red book, make sure you get the red book, make sure you get this, make sure you know what percentile they're at, make sure you know all this information. I mean, now for us, that's still relatively important. That's still vital to understand how a baby, how a child is developing.
Oh, totally. Yeah, and also when a baby's brought in, you take a thorough history because you need to know what was the delivery like, how was the mum's pregnancy, how's the baby been from birth, do they